parents don't feel comfortable to
Correct.
even discuss few things with their kids.
Correct.
So AI is best for them as well.
Right, Hamza. Lovely. Good points. Yeah. Thank you, Hamza. Thank you for the call.
Nice talking to you.
Yeah, no problem.
Right. आप भी phone कर सकते 800-81003. Now we've got a psychiatrist with us, Carolyn Yaffe. A pleasure to have you on our show, Carolyn. Good morning.
Good morning.
Thank you. Good morning.
So young people resorting to generative AI like ChatGPT or Gemini for therapy, recommended, not recommended? Your thoughts on this, Carolyn?
Well, I think that there's maybe a positive, but a lot of negatives. And, I think the positive is that somebody that's, just looking for a quick answer. I think that sometimes ChatGPT, if you're looking for specific strategies, for example, if you're experiencing severe anxiety and you're just looking for some mindfulness activities, I think ChatGPT is okay because I think it definitely can give you the answers and some strategies and some techniques.
So what?
However,
Yeah, yeah.
I'm sorry, go ahead. I was going to
No. Please
go ahead.
continue. Yeah, yeah.
No, I was going to say, however, it does lack the ability to offer any personalized advice. Like there's no deep understanding of your particular circumstances, which a trained therapist would be able to provide. And it also is crucial to ensure that you are engaging with the AI in a safe way. Do you understand what I mean? So, there's no personalization. It can't understand your personal history, context, nuances in the same way that a human being can, a human therapist. So this can really lead to sort of canned generic advice that may not be relevant or helpful to your specific situation. There's no understanding of emotions. The AI may not fully grasp, a complex emotional issue, and it may not really provide the empathy that one may need. So emotional intelligence is really crucial in therapy, and AI cannot replicate that.
Carolyn,
But again,
have you been using
go ahead.
any AI tools that you've been using, for your clinical administrative purposes that have helped you to better understand the case history and the patient history?
Well, not necessarily to help me understand better. I think AI can be helpful in, like, for example, using tools like Grammarly to help you write. I mean, I think that's fine. And that's definitely very helpful to me. But I would never ask it clinical questions that I should know as a therapist and as a practitioner. Because first of all, it's not going to give me the same, for example, as therapists, we all need supervision. We all need another therapist to work with, to help us, to guide us. ChatGPT really cannot provide us. These are canned answers.
Given the lack of genuine empathy, how does this limitation affect role in therapy and patient trust overall, Carolyn? Where do you see the use of AI?
Well, where do I see the use, or where do I see the lack of empathy?
I believe in the lack of empathy in that angle.
Well, because it's not a person. I mean, you're talking to a computer. How is a computer supposed to generate empathy? Chat AI. I mean, I've literally had clients that have talked about going on ChatGPT, and they say, "Well, I asked ChatGPT, and he said that." It's not a he. It's not a he. Do you know what I mean? And I think that people often get sort of fooled into thinking that there's another person there. There's another person there for them. It's not. It is not a human being. There are no nuances. It can't understand your personal context. It can't do the same. It can't understand your personal context. It can't do the same thing as a human therapist can do. And it is concerning to me because I think more people are turning to it.
Right, Carolyn.
There's no professional training.
Right.
Right.
terms of
Yeah.
daily outbursts, daily questions, simple ones, people are resorting to it, and I think there is no harm in that in terms of getting.
Well, I think it depends on the question. For example, if I was having a panic attack and I put into Chat GPT, please write out some deep breathing exercises for me. That's okay. That's okay. That's
Right.
a very, that's a very simple question that doesn't take, that doesn't take empathy. People can Google that. It's the same thing. It's the same thing. It's just informational. But I also want to just say one thing to your listeners, is that with AI and ChatGPT, there is no crisis management. And what really concerns me is that if someone is in a crisis or experiencing, a severe mental health issue, I worry that people are going to try to turn to AI for support, and it is not equipped to handle such situations. And this really, it's very important that they get immediate support from a mental health professional or go to a hospital. That's what really concerns me about the ChatGPT therapist.
Right. Carolyn, lovely talking to you. Thank you so much for these amazing insights. And yeah, whenever in crisis, you should definitely see a professional and not resort to technology.
Thank you. Thank you so,
Thanks,
so
Carolyn.
much.
Thank you.
Talk 100.3. This is Fan Network News from the BBC.
BBC World News, I'm Tom Dewsbury. One of the strongest recorded earthquakes in modern history has triggered tsunami warnings across large parts of the Pacific. The quake off the coast of far eastern Russia had a magnitude of 8.8. Evacuation orders are in place on Japan's eastern coast and Hawaii. There are no reports of widespread damage so far. Israel